Good evening, everyone. Thank you so much for joining us. We're just going to give it a minute so everyone can enter in the room. Thank you for your patience. Okay, just another couple of seconds. Thanks again for your patience. I know it's dinner time. Okay, wonderful. Good evening. So glad you could all join us tonight. I'd like to introduce you to our host, Dr. Jennifer Landa. Dr. Landa has been the CMO of BodyLogicMD for over 15 years. She's also the owner and operator of BodyLogicMD of Orlando. She is board certified in integrative medicine, and she's an OBGYN. Dr. Landa, take it away.
Thanks so much, Deb. I appreciate it. I'm so excited to be with all of you here tonight to talk about weight loss, hormones, semaglutide, and menopause. So let's jump right in. If my slides will change. Here we go. All right. So a question you may have asked yourself hundreds of times, maybe, is why on earth am I gaining weight? Why can't I lose weight? I've limited my calories. I've exercised my buns off. I'm doing everything I'm supposed to be doing. And, people have always blamed it on calories, exercise, willpower, but it might not be any of those things. It might be hormone imbalance. One of the things that I want to emphasize is that this is not about fat shaming. This is not only about our looks. Of course, that's one reason why people want to lose weight, but I want to emphasize a ton of research that's been done in the last maybe 20 years or so that has shown us why it's actually dangerous to be overweight or obese, because women who are overweight or obese have a higher risk of dying from anything. And that includes all the coronary risk factors like high blood pressure, high cholesterol, triglycerides, heart disease itself and stroke, dementia, osteoarthritis, aging arthritis, cancers of many types. So the bottom line is anything that's going to get us, that's going to hurt us, kill us, make us sick, all will be worse if we have excess weight. So that's one of the reasons that I think it's really urgent to lose some weight if you've got a weight issue. And I know a lot of you are here because you're concerned about that. So let's jump into what hormones are. Hormones are your body's messengers. Hormones take a message from one place to another. They take a message from your brain to many other tissues in your body. And then many of the tissues in your body send messages back up to your brain. And that's really where hormones do their job. That's their work. So what about the hormones involved in weight gain? There are lots of them. Some of them you may or may not have heard of. We're going to talk a little bit more about tonight: leptin and ghrelin. Also, of course, insulin, one called GLP-1, glucagon, cortisol, some of the sex hormones like estrogen, progesterone, testosterone, DHEA, and growth hormone. So the woman's on a tightrope because hormones have to be in balance for them to work well in our body. So these are three of the classic hormones that are known as the fat hormones: insulin, leptin, and ghrelin. They're the three main brain signals associated with intake of food. Leptin is the satiety hormone, meaning leptin tells us, okay, you've had enough. I'm full. I don't need any more. Proper amounts of leptin make you feel like you're not hungry. It suppresses the appetite, and higher leptin levels can be seen in overweight people. And then you're saying to yourself, well, that doesn't make any sense. Why would there be higher leptin levels? The reason for that is something called leptin resistance. You may have heard of insulin resistance, which we're going to talk more about in a couple of minutes. There's also such a thing as leptin resistance. Then you've got ghrelin. Ghrelin is the hunger hormone. It stimulates your appetite. It's secreted when you're hungry, and it is decreased by insulin. So let's talk about insulin and insulin resistance, because that is a really important hormone here in this whole thing. How does it work? So with all hormones, I say, it's like hormones are like Goldilocks's porridge. You don't want too much and you don't want too little. It has to be just right. And too much insulin is the same thing. Too little insulin, it's not good either. So why? What does insulin do? Insulin drives glucose or sugar into your cells so your cells can use it to make your muscles move, to make your brain work, all the things that we need sugar for. So insulin works, I say insulin works like a broom. It sweeps the sugar into the cell because that's where you need it. The problem is when people gain weight, their brooms, their insulin, can become dysfunctional. So it's kind of like having a broken broom, and then the broom doesn't work well to sweep the glucose into the cells. And that causes your body to think that you don't have enough insulin, that you don't have enough brooms. And it calls more brooms and more brooms onto the scene. And so that's why you have the situation of insulin resistance. You have lots of insulin, but the insulin isn't working effectively. So what are some of the solutions to balancing ghrelin, balancing leptin, balancing insulin? So some strategies that you can implement right now is, one is to eat more protein. You want to eat approximately 0.5 gram per pound of body weight. Now that is very debated in many different circles, but that's a good guideline if you haven't been paying attention. Fiber. So you want to eat at least 25 to 35 grams of fiber, and even more than that will help you lose weight because it helps with fullness. And another thing to include in your diet is more monounsaturated and polyunsaturated fats and less saturated fats. We'll go over what those are in just a moment. And another thing is low glycemic index carbs. So carbohydrates that don't raise sugar and insulin as much, like staying away from things like white potatoes, white rice. I'm sure you've heard a lot of this. And let's look at the fats. So we said we want to do more MUFAs and PUFAs. Those are the monounsaturated and polyunsaturated fats. And those are the plant-based foods that you see on the right. Olive oil, flaxseed, avocado, nuts, fatty fish. Those are the kind of fats that you want to emphasize in your diet. And you want to de-emphasize the animal fats. Red meat, lean chicken is okay, but you want to replace some of your meats, depending on how much meat you eat, with some plant-based foods and some good oils. Other strategies to lower leptin and to lower leptin resistance and to lower ghrelin levels. Intermittent fasting, that has gotten really popular these days. You may have heard about it. The idea is to try to not eat for somewhere between 12 to 16 hours a day. And some people are even pushing that even further. I've heard of people doing it to 20 hours a day, and some people even fast for 24 hours. Now, that depends on your medical condition. There's a lot of variables that go into that. But it may be better to group your food into smaller eating windows, they call that. So a lot of people do 16-8. That works well for them, meaning eating for an 8-hour window, like let's say noon to 8 p.m. or 11 a.m. to 7 p.m., and then not eating the rest of the day. Another thing that improves your hormones for weight loss is high intensity exercise. So HIIT training, they call that. And that's been shown in studies. So what about semaglutide? A lot of us have been hearing a lot about semaglutide, so we're going to talk about that. I've been using semaglutide in my practice for maybe almost a year now, and it really is a game changer for some people. In addition to that, we're going to talk about how the female hormones play a role in weight loss. So what about semaglutide? Semaglutide is a GLP agonist. That means, remember, I don't know if you remember, but GLP-1 was one of the hormones I said can play a role in weight loss. And semaglutide acts like GLP-1. And that's how it acts in the body. And what does that mean? So as you can see here, GLP-1 in the brain regulates appetite, and it regulates multiple other things in the body. It stimulates the release of insulin and it improves the function of insulin when we were talking about before that dysfunction. It reduces sugar production. It slows the emptying of the stomach, so you feel more full when you're on it. And it changes ghrelin levels so you don't feel so hungry. And that leads to weight loss. So it definitely helps control blood sugar. I've put many patients on it who've been type 2 diabetics or pre-diabetics, and it's really improved their blood sugar leaps and bounds. It's pretty amazing. People get better craving controls. So if you tend to crave sugar or you tend to crave potato chips or whatever it is, you get better control over those cravings. Even alcohol, you may have read about that in the media. It's convenient. You only need to take it once a week. And like I said, it makes you feel more full, so it reduces your appetite, and it reduces the risk of all those diseases we talked about before as you drop the weight. So this is my medical assistant. We've been working together for many years, and she had a lot of challenges losing weight. And this is Kirsten's before, which is about 8 months ago now, maybe. And this is her after picture. One of the things to note is that she didn't lose the weight quickly. I mean, fairly quickly in the scheme of things, but I've noticed a lot of my patients when they're on semaglutide, they say, I'm not losing weight fast enough. They want it to come off even faster than it is. I don't agree that that's the best thing. I'm looking for about a pound a week is reasonable in my opinion. And I have lots of patients like Kirsten who've been doing just that. And it makes an amazing change, but it does take time. And I think that's something that we should strive for. I don't think it's healthy to lose tons of weight very, very quickly. So Kirsten is thrilled with her weight loss. She feels so much more confident, so much better about herself. She sent me a picture not a little while ago that she was in her like high school jeans. And I was like, you gotta be kidding me. This is crazy. She has more energy, less joint pain, and her quote that she can look at herself again without feeling gross or disgusting, which that's a sad thing to see. But at the same time, a lot of us can relate to that. A lot of us have a lot of negative self-talk based on weight that we've gained and find it very hard to take off. So semaglutide's not going to work for everyone. Some people have side effects from it that can be difficult to tolerate. So there are many other choices. The other thing is semaglutide is an injection, and some people just don't want to do an injection, and that's okay. There are oral options that work very well as well. So what about your menopausal hormones, and how are they involved with your weight loss? Well, if you're having menopause symptoms, and that could be anything from trouble sleeping, joint pain, of course, the classic night sweats and wrinkling of the skin, vaginal dryness. But sometimes your symptoms of hormone imbalance and hormone loss can be much more subtle. And, dry skin, joint pain, and trouble sleeping. Some people just chalk that up to aging, but that can be from loss of hormones. And there are risks to going without hormones. For instance, the Nurses' Health Study, it's one of the largest studies that's been ongoing for many, many years, almost 300,000 men and women. This particular study looked at women who had their uterus and ovaries removed for benign disease, not cancer, and their full hysterectomy, meaning their uterus and ovaries were taken out, led to a higher risk of dying from anything, having a heart attack, and having lung cancer. So I know a lot of women are afraid of hormone replacement, but we need to remember that there are serious risks to going without hormones as well. So what about weight gain? Menopause, we all know that we get that dreaded round the belly weight gain when we go into menopause. And you can see the picture of it right here, that the funky, weird yellow stuff on the picture on the right. That is a picture of the fat that women gain in their belly when they go into menopause, when they don't have estrogen. And that belly fat is particularly significant because belly fat, you may have heard, increases your risk of all those diseases we were talking about before. So hormone replacement therapy has actually been shown in many studies. This was an analysis of 107 trials that showed that hormone replacement therapy reduced abdominal fat and the new onset of type 2 diabetes. Hormone replacement therapy improved muscle and decreased fat. Isn't that what we all want? And there's a reduced risk of metabolic syndrome with hormone replacement therapy. And metabolic syndrome, basically all the risks that lead to heart disease, abdominal weight gain, high blood pressure, diabetes, all of that stuff goes together. So now you might be sitting there going, well, what do I do? The media tells me hormones aren't good. Hormones are going to give me breast cancer. So what do I have to do? Just take my choice, breast cancer or be fat? No. Hormones are not all the same. And the hormones that have been talked about as causing cancer are artificial hormones. They're hormones that are not the same as what your body makes naturally. The hormones your body makes naturally are called bioidentical hormones. And bioidentical hormones do not increase the risk of breast cancer. So what are bioidentical hormones? They're derived from soy and yams, so they're from natural sources, and then they're made into hormones that are exactly identical, thus the name, to what you have in your body naturally. So what are the benefits of hormone therapy? I see it every day in my clinic for the last 20 years. I see it myself personally. I'm on hormone therapy, of course, and you get more energy, better sleep. Better sleep is probably one of the most important things to highlight, because if you don't sleep, nothing else goes right. Your moods are terrible, your brain, you can't think, you get irritable, you don't have energy, then you wind up not going to the gym, you wind up not preparing good meals, and before you know it, yes, you gain weight, even more weight than you would have gotten just from plain old menopause. So getting people back to sleep is huge. Getting rid of the hot flashes and night sweats, helping promote that weight loss that we're looking for, improving sex drive and sexual function, helping the brain, better memory, better movement, and decrease risks of disease. Why? So let's talk about these hormones. What's up with these hormones? So estrogen itself has almost 400 functions in the female body. And when I look at menopausal women's hormones, their estrogen levels are pretty much almost undetectable. So what happens? Ask yourself, what happens to the 400 functions in my body that rely on estrogen when I have nearly undetectable estrogen? Obviously, things don't go well. And that's a big part of the reason your body gives you hot flashes. It's to tell you things are not going so well in here. So Things to know: women with lower estrogens suffer from a decline in brain volume. So literally, estrogen is associated with having a bigger brain. So lower levels of estrogen due to hysterectomy leads to smaller brain volumes. But women who use HRT have bigger brains than women who've gone through natural menopause with no HRT. This is a fairly new finding. What about your bones? Well, of course, our risk of osteoporosis increases. In the first 5 years of menopause, we lose the most bone that we're going to lose in our entire lives. And studies show, including this new study, fairly new study from about 5 years ago, they propose that hormone therapy should be prescribed for the prevention and treatment of osteoporosis. That's how strongly these researchers feel about how much estrogen helps the bones, and published in Osteoporosis International, so pretty significant. What about the heart? Cardiovascular disease, let's face it, is the #1 killer of women. And estrogen treatment reduces the formation of plaque in your arteries and your risk of heart attack. What about vaginal dryness? Well, the interesting thing is, women talk a lot about changes in mood with menopause, trouble sleeping, the hot flashes, but nobody really talks about what happens to your vagina. And sadly, it shrinks and shrivels until you have what's going on the right-hand side. You see how that vagina is much thinner, the uterus is thinner, smaller, the ovaries are smaller. All of our tissues shrink with the lack of estrogen in menopause. And that is very easy to treat with hormone replacement therapy. So bioidentical estrogen, in summary, it improves cholesterol, it reduces your risk of heart disease, it slows bone loss, and even can help improve bone. And it prevents colon cancer, improves your memory, reduces your risk of diabetes, and it helps you lose weight. And bioidentical estrogen has not been linked to an increased risk of breast cancer. So what about progesterone? Progesterone is such a wonder hormone. It balances the effects of estrogen, and it has a calming effect, and it helps improve mood. It also has beneficial heart effects, brain and nervous system effects. It also helps balance blood sugar, helps your thyroid work better, and helps rebuild bone. So it's got a lot of positives. Because it's calming, though, one of the things it does is it really helps sleep. Here you can see all of the heart benefits. Progesterone helps reduce bad cholesterol, blood pressure, plaque in the arteries. And what about your brain? Like I said, progesterone actually helps reduce the risk of forming certain abnormalities in the brain that mimic Alzheimer's. And progesterone breaks down to hormones that are neuroprotective, which means they protect your brain. There's such a thing as artificial progesterone. So before, when I said artificial hormones, one of the big artificial hormones that increases the risk of breast cancer and does a whole bunch of other things is the artificial progesterones. There's a whole class of them. And they cause lots of other side effects. These are like similar to the hormones that you see in birth control pills, but they also put them into menopause hormone replacement, the artificial ones. And it can cause all of these negative symptoms. But natural progesterone, bioidentical progesterone, like I said, it helps sleep. That's one of the most beautiful things about it. Women tell me, I can't sleep without my progesterone. I need my progesterone. I love my progesterone. It also helps with metabolism. So that's really important and key for losing weight. It also has a calming effect. So I find some women in perimenopause and menopause get more impatient, more irritable, and progesterone can be a key hormone in improving those symptoms. What about testosterone? Well, testosterone is actually my favorite hormone for women. And I know that sounds funny because everybody knows about testosterone in men, but women have it too. And it helps with energy, memory, mood. It helps us build and keep muscle and lose fat. and it helps protect our bones, and it helps with our sexuality. So many great things that testosterone does. So what are some of the signs that you may be low in testosterone? So testosterone just goes down as we age. We have the most testosterone we're ever going to have between the ages of 18 and 34, believe it or not. And then it just goes down, 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 down every year. And these are some of the signs and symptoms that you might have testosterone loss. So believe it or not, wrinkles, thin lips, thinning and dry hair, changes in your skin, and especially anxiety, fatigue, low energy, things like that can really be associated with low testosterone. Causes of low testosterone. Well, the number one, as you see there, is aging. Huge. But there are medications that can cause low testosterone. Even birth control pills in some women can cause low testosterone. And believe it or not, this is how I found all of this whole field of bioidentical hormones, because when I was 28 years old, I was going through hormone changes. I was on the pill, and I didn't understand, even as an OBGYN, how to fix my own problems until I started learning more about bioidentical hormone replacement. And I realized my birth control pills were really causing a big problem for me. And I had lost my libido. Then I wound up losing my energy, changed my mood, all kinds of problems. And it took me to my mid-30s to figure this out. But it's been great ever since then. I've been on hormones and continue to be to this day, more than 20 years later, and thrilled to be doing it for my patients as well all that time. So testosterone replacement therapy, as you might imagine, it improves energy, it improves memory, it improves your muscle strength, helps you lose fat, and it acts really as an antidepressant. It just makes people feel more confident and like everything's all right with the world. It helps restore your foundation. I have so many patients who tell me, now I look in the mirror and I just feel like myself again. And that's really my big goal. So hormone levels need to be measured. So what we do when we see patients is we measure hormone levels prior to starting a patient on hormone therapy and then throughout hormone therapy. There are some practitioners that say that they can figure it out without the levels, but I beg to differ. I think it's much safer when you're measuring levels. And I think it's much more clear which hormones are out of balance, because some symptoms can be the same for multiple different hormone imbalances. So measuring, I think, is very important. We use any kinds of, it could be just blood, it could be blood and urine, it could be blood, urine, and saliva. All of those can be keys to finding out what hormone imbalance a woman might be suffering from. So that was a whirlwind, a lot of information. I hope it helped you be a little bit more clear about hormones and weight loss. And I'd love to stay on and answer any questions that anybody might have.
So the chat is open. Thank you, Dr. Landa. That was very informative.
My
The chat
pleasure.
is open for questions, or we also have a couple of wellness advocates standing by. If you'd like to go ahead and schedule an appointment or a consult with one of our practitioners in your area. And their phone number is up on the slide, 877-846-9009. Or you can always reach them Monday through Friday from 8:30 to 6 p.m. Eastern time. And we have some questions, so let me see. Dr. Landa, someone has asked, should you intermittent fast at any time of the month during a special window or during your cycle?
Good question. I'm not aware of any research that pairs it with the menstrual cycle. The one guideline I would give on intermittent fasting is if you're already super exhausted, it might not work really well for you. So, and you might have even already tried intermittent fasting. It might have worked really well for you. It might have not worked well. I do find that different populations of women, it works differently consistently for. So it's interesting because it might be hormonally related, but one of the things that I find it can be a hindrance in women who are not who have what we have classically called adrenal fatigue, women who are very tired. I don't really recommend it. Those women, I actually recommend having small, frequent meals throughout the day. So I would say it's a matter of tuning into your body, seeing how you feel, and then going from there in terms of the intermittent fasting. And really, you just got to give it a try and see if it works for you. I've had many patients who tell me it works wonderfully, and I've had many patients who say, "Oh no, that doesn't work for me at all." So it's one of those things you just got to try.
Thank you. This is a good question. Do you need to stay on semaglutide for life? What happens after stopping it?
That's a very, very good question that lots of us are looking into and learning more about now. So I would definitely not say you need to stay on semaglutide for the rest of your life. For sure, that's not what I would say. I actually already have patients who have met their weight loss goals, come off semaglutide, and been successfully keeping the weight off by changing their lifestyle, basically. That's one thing that's very important, that semaglutide helps you change your lifestyle. It helps you make, let's face it, a lot of us know what we need to do to lose weight, but we're just not able to do it. We're not able to be consistent about it. The semaglutide gives you a real running head start by, let's say you're on it for 3 months, 6 months, a year, whatever it is that your weight loss goal entails. It gives you this long learning period of eating in a healthier way, because in a way, semaglutide, it's like cheating. It's just, you don't have as much of a craving. You don't want to eat bad, quote unquote, bad food. You want to eat healthy. You want to get healthy. You feel so good because you are healthy. You don't want to go backwards. And so then even when you cut out the semaglutide, it's easier because you're in new habits. You've built new habits. And the other thing is, you can always do what I would call kind of a touch up. If you find that you're starting to gain weight and the cravings are having their way with you, they're taking over and getting control, then okay, you hop back on semaglutide for a couple of months, get it under control, and then you're usually able to slide back off it again. So definitely not a for life. And the other thing is that there are oral options that can work well. There are some supplements that can work well that you can do as a follow-up to semaglutide. There's all different kinds of solutions. So I would definitely not say that it's a life sentence to be on semaglutide.
Excellent. Are you concerned about not being able to get semaglutide in the future?
Yes, frankly. Thank you for asking that question. So the drug company that makes semaglutide did not make enough to meet demand. So right now it's on a shortage, and compounding pharmacies are able to fill that shortage. They're able to make semaglutide or produce a semaglutide product while that shortage is happening. Eventually, if there is no longer a shortage, then there will be stock of semaglutide in the pharmacies, but right now my understanding is that it's extremely expensive. If you are able even to find it in a pharmacy, it's over $1,000 a month, which really is not sustainable for many people. So I hope that we're able to continue to have a supply of semaglutide that can be more accessible.
This is a good question regarding testing. So I'll only mention first names. Christine has asked, I've tried to do some reading on hormone therapy and found that there are people that say hormones can't be measured accurately. What are your thoughts?
Well, I don't think that's necessarily true. They can be measured and measured accurately. I think it's more of a matter of knowing what the right hormone levels are for people. Because the hormone, the classic companies that measure, that we all get our blood drawn by, to, get a CBC or something like that. Those labs have very, very large ranges of what's considered normal for hormones. And those don't take into account what would be optimal for hormones. And that's where training with physicians and physician extenders at BodyLogic come from. We study for extremely intensely and for long periods. We really do a lot of education around what are those optimal hormone levels that and what are the optimal hormone balances that keep us feeling our best. So absolutely they can be measured. It's just a matter of knowing what the right ranges are for patients.
Thank you. Can bioidentical hormones be used for someone who's older than 76?
I love that question. The answer is yes. Most people in general are candidates for hormone therapy. But in terms of age is not an exclusion. It used to be. When there were the early studies of these artificial hormones I was mentioning before that increased the risk of breast cancer, what they noted was that older women on those artificial hormones had an increased risk of heart disease. Now that a lot more studies have been done of the bioidentical hormones, what they showed was bioidentical hormones do not increase the risk of an older woman's risk of having a heart attack or heart disease. So the American College of OBGYN, all the way back in 2014, said that we do not have to take women off hormones just because they've reached some magic age of 60 or 65. Unfortunately, not some of our colleagues haven't gotten that message, and they still think that it's shortest time possible for that was like the mantra for a while about hormone therapy. But if you're using bioidentical hormone therapy, I think it's safe to do for your lifetime. I have patients in their 80s actually that are doing great on bioidentical hormones.
Lori asked, I've been on hormone replacement therapy for over a year with no changes to my weight. What is some advice?
So hormones need to be balanced properly. So there may be a hormone imbalance going on, or the hormone therapy may be inadequate. You may not be quite at the levels that you need to be at. Or sometimes, even though you're on hormone replacement therapy, you may need some extra help with something like semaglutide or some of the oral alternatives that are out there. Menopause hormone replacement therapy is not always going to be a magic slam dunk that you're going to lose all your weight, but most women are able to shed some pounds when they go on menopause hormone therapy.
Does bioidentical testosterone increase bad estrogen?
Does bioidentical testosterone increase bad estrogen? Well, it increases estrogen. It can increase estrogen in general. It's the job of the practitioner that is administering the hormone replacement therapy to make sure that the estrogen that's being made is not quote unquote bad estrogen. So you make a good point. There are good and bad estrogens. And that's one of the reasons that we do certain testing that we do to look and see whether the levels of bad estrogens are going up. So genetically, some people will make more bad estrogen than other people. And that's something that we measure and we control for.
Great. We're getting good questions on testing tonight.
Yeah, great questions.
You mentioned the importance of checking hormone levels prior to initiating therapy. But since hormone levels fluctuate, how do you ensure clinically useful information from testing?
Wow, that's a really great question.
Yeah.
So you bring up a good point, and it is true that hormone levels change all the time. They go up, they go down, and they're so we are only getting a snapshot in time. In menopausal women, their hormones are generally in a fairly stable range. Now, when we're talking about premenopausal women, that can be more of a challenge. And so we have particular times in the cycle when we ask women to test. And if we really can't figure it out, we can do a special test where we can test multiple times throughout the cycle. Great question.
Yes, I agree. Okay, how does semaglutide work with thyroid or adrenal issues?
So semaglutide can still work well if somebody has thyroid or adrenal issues, but those thyroid and adrenal issues, of course, need to be addressed as well, because hypothyroidism, for example, causes weight gain. And the changes that happen with the brain and adrenal axis, or the stress system, if that's off, what you're referring to as adrenal hormones, that can lead to all kinds of trouble. And metabolism, how well you metabolize, is one of those issues. So you would need to fix the thyroid issues and the adrenal issues concurrently with semaglutide is a possibility. Or, depending on how severe those issues are, you might want to fix those issues first and then go to semaglutide. That would be very individual basis.
Makes sense. I'm 64 and had a hysterectomy at age 42. I was on hormones a few years. Is there a chance I could go on HRT now? I'm overweight and tired, and everything you discussed describes me.
Oh, I'm sorry to hear that. And it's unfortunate, like I said, that that some people won't keep women on hormones, because if you keep them on bioidentical hormones, it's much safer. And there would have been less risk that you would have gained the weight probably had you stayed on the hormones. But anyway, can't go back in time. So yes, the answer is yes, you could be on hormone replacement. Based on what you've told me so far, it sounds like you would be just an absolutely fine candidate for hormone replacement. And it sounds like you really probably could use it because you have a lot of the symptoms that we talked about.
This is a good question regarding insulin. I felt the same way. What about the sector of people who were chronic dieters and restrict intake, but now want weight loss meds for menopause? Will this even be effective as it further restricts, or is there some insulin resistance it can combat?
Yes, that's what's fascinating, and semaglutide is fairly new, let's face it. So we're still figuring out what exactly it is doing. But in addition to just plain old cutting calories, it seems to make significant metabolic changes that allow the body to finally start releasing the weight. And, if that is not effective for somebody, there's another option that is kind of the second generation of semaglutide. It's called tirzepatide. It's even more effective than semaglutide because it adds yet another hormone. It's a 2-in-1. And so for people who aren't successful with semaglutide, tirzepatide is something that we also could try with them. And so don't think that it's strictly calorie restriction by reducing the appetite. There are many other metabolic changes going on as well. Like you said, it does affect insulin, it does affect blood sugar, and it seems to have many other effects throughout the body.
Excellent. Here's switching back over to hormones for a minute. Does the testosterone cream work, or do we need a pellet?
That's a good question. I've seen testosterone cream work well for some of my patients. I would say the majority of my patients, though, seem to do better on testosterone pellets, or even testosterone injections. So personally, my biggest hormone problem when I was really young was testosterone related. So I've been on testosterone since my early 30s. And I've been on all the different kinds, and the most effective for me have been pellets and injections. And for many of my patients, but I do have some patients who do react well to the cream. Yeah, so I would say the minority of my patients are on creams for testosterone.
Okay, great. Can you take semaglutide if your insulin and glucose levels are okay?
So that's a good question, and that's sort of so that's a question that nobody's really asked, and maybe you wouldn't, but so I guess that sort of leads me to talk about the FDA has approved semaglutide for weight loss in women, well, men and women, over a certain threshold of weight, right? And essentially, and so, but then they've also approved it just for, so they've approved it for diabetes first, and then they've approved it for weight loss. And the same thing seems to be happening for tirzepatide. Tirzepatide is approved for blood sugar, type 2 diabetes, but I think it seems that it will probably be approved for weight loss as well. So semaglutide is approved for weight loss in people whose blood sugar and insulin are totally normal. But then the question is it, can you use it in people who only have a little bit of weight to lose? And that's a question for your individual practitioner. But they may be willing to prescribe it what we would call off-label. And that would be something you would discuss with a provider.
Okay. Oh, here's a question I can answer. How much is semaglutide generally? So that's not a straight answer because the cost of semaglutide does vary by state to state. However, it will generally start at $2.99 a month and go from there, which I have to say is extremely competitive. Very reasonable considering some of the pricing out there.
Most patients, by the way, are successful at the level of $2.99. The prices go up with larger doses, but most people don't need larger doses.
Right. I know hormone therapy works for me, but I have had hormone therapy work well and then not work well. If you have a patient during doing therapy, hormone therapy, would you also suggest the semaglutide to go along with?
So yes, I've had many patients who have been long-time hormone replacement patients, and the hormone replacement is working well for them, but they haven't been able to shed the pounds that they would like to. And then yes, you can layer semaglutide on top of menopause hormone replacement.
Okay. How about, does your body build up resistance to your maintenance doses? We have some pros on tonight. That's all I'm saying.
Yeah, seriously.
Does your body build up resistance to your maintenance dose of semaglutide? And might it need to be increased once you're maintaining?
That is possible, absolutely. So semaglutide is advanced slowly. So you go on a really small dose, then you increase it, and then you increase it. And part of the reason that you need to increase it is because as your body gets used to it, it can build a tolerance and you don't see the same results. You get to the maintenance, what most people call the maintenance dose, and then you may need to go up from there. Some people do. I would say in my experience, most people don't need to go up. And the few people that I've had go up really high, they've actually found it ineffective. So it doesn't work for everybody 100%. And like I was saying, that's when you might want to go. So, you can maximize the dose of semaglutide. And then if it's really not working for you, you might want to try something like tirzepatide.
Right. We've had a couple of questions regarding insurance. So generally, insurance does not cover the cost of the meds. That's for semaglutide and bioidentical hormones. However, depending on your insurance, they will reimburse you for the labs. And then this is a good question too. What supplements are recommended after semaglutide? I know we stock a lot of them here at BodyLogicMD.
Yes, that is a good question. So I would tend to use supplements that have some of the same actions or similar actions. So one of my favorites would be berberine. Berberine is great at helping to manage glucose and insulin. So that would be one that you could try. Cinnamon, actually, adding cinnamon to your food. Cinnamon is a very good blood sugar manager. Others include Gymnema sylvestre. Making sure even that you have adequate amounts of magnesium. There's alpha lipoic acid. Sometimes I use these in blends together. These are all blood sugar managing supplements, and that would be where I would tend to go. But you can do other things like conjugated linolenic acid, which helps burn fat. You can do some thermogenic type supplements. There's a whole slew of things that you could use depending on your needs. One of the, through my work in my integrative medicine practice, we do testing sometimes to determine which supplements are actually the supplements your body needs. So you may have an amino acid deficiency, so I need to supplement your amino acids, and that may help you lose weight. Or you may have trouble with your mitochondria, and we need to supplement there. And then you're able to burn fat more efficiently. You're able to turn glucose into energy more efficiently. So there can be lots of different answers to that question, but those are some of mine.
Okay. A couple of you have posted in the chat, how can you get an appointment with one of our practitioners? I don't know if you missed it at the beginning when we opened up, but we have a couple of wellness advocates standing by this evening, and they'll be happy to get you scheduled with a practitioner in your area. The phone number is right up on the slide. Again, it's 877-846-9009, or they're also available Monday through Friday from 8:30 a.m. to 6 p.m. This is a good question regarding soy. I've read that soy is bad. Would you speak on that as it relates to bioidentical hormones?
Oh, that's a good question. So soy and bad is really what I would say. It comes, the bad soy is what I would call processed soy, highly processed soy. So soy milk, soy yogurt. I'm not a big fan of those highly processed soy products. The reason why, it's kind of like, if you picture a soybean, so let's start with the fact that there's estrogen in soy. And the estrogen is kind of at the heart, at the kernel of the soybean. So if you're eating a soybean, there's a lot of fibrous tissue and other things that surrounding that little estrogen kernel, so that you're not getting this huge hit of estrogen. But when you highly process the soy, it can change the soy so that it becomes more estrogenic, and it can be excessively estrogenic. And just like I said with hormones before, too much is bad, too little is bad. You want to have it be just right, and having too much estrogen from even phytoestrogens, plant estrogens like soy, can be bad. Now, bioidentical hormones that are derived from soy are made into exactly the same hormones that we have in our bodies naturally. So they're indistinguishable. So just because they come from soy, it doesn't mean you're consuming soy at all, really. You're consuming a hormone that is exactly the same as what's in your body naturally. It just happened to have been derived from soy, if that makes sense.
Absolutely. Someone has asked about the oral alternatives that you referred to earlier for the semaglutide weight loss.
So there are many oral options. Some can be just supplements like we talked about before. But in addition to that, I like combinations of things like bupropion, maybe combined with naltrexone, so bupropion is it's classically an antidepressant, but it's been shown to help reduce cravings. And naltrexone does the same. It helps with cravings. And then also to use metformin with that. And metformin is classically a diabetes drug, but it's actually being studied now as an anti-aging drug, which is very interesting and exciting. It causes a lot of different changes in the body that can be very helpful and very healthy. So there are definitely some good oral options to consider as well.
Excellent. So we only have time for one or two more questions. This is we've had a couple of questions regarding what are the main side effects of semaglutide? And then that's coupled with, would it affect my anxiety medication? I'm nervous because I don't want to mess with the medication I already take.
Okay. Well, let's start with the side effect question. So the side effects that are most common with semaglutide are pertaining to its main effects. So that means they're gastrointestinal. You might feel a little nauseous because of that feeling of fullness. You can feel a little nauseous. Some people have complained about constipation. So it can be a good idea to do a little extra fiber or maybe even some propylene glycol. Over-the-counter treatments for constipation might be necessary. Some people get more sort of gassy or burpy, things like that. I've prescribed digestive enzymes that have been really helpful for some patients to get around those side effects. The main thing with the side effects is that you can see them when you first start and then when you jump doses. So you want to jump doses slowly to the amount that you're able to tolerate. So I've had some patients, actually, believe it or not, who don't even get to the maintenance and they're losing weight. So we don't increase. We just stay at the lowest or the second lowest. Most people, I would say, get up to kind of like the second level. They're able to graduate beyond that first level. And it's very rare to have patients who feel sick enough that they are just not able to deal with it. On occasion, we give people anti-nausea medication, but most patients are able to deal with it just with like some ginger, some vitamin B6 is good for nausea, and aromatherapy with peppermint also works well.
Great. Well, listen, thank you so much, Dr. Landa, for all the wonderful information you shared with us tonight. And ladies,
pleasure.
this will all be available. The recording will be available on YouTube. And you can also request a copy. You'll get a post email from after the webinar. And I'd like to thank everybody who attended and everybody who hung on till the very end.
Yes,
Have a great
thank you
night.
so much.
Yes, absolutely. And again, you
And
can
thank
either
you.
email wellness@bodylogicmd.com or their phone number to reach any of our wellness advocates to schedule is 877-846-9009.
Thank you.
Thank you. Have a great night.